Welcome, and thank you for joining us for our 2024 Montana State Capitol Day event. My name is Katie Levine, and I'm the Executive Director for the American Foundation for Suicide Prevention Montana chapter. We are so glad that you've chosen to be here today, along with other advocates, to learn about how policy changes and legislation can save lives. As you can see, we have a full agenda. We will begin by providing a brief introduction to AFSP, as well as an overview of advocating with us. We'll then highlight some suicide facts and figures for both our state and nationally, as well as review some lawmaking basics for those who may be new to advocacy. We'll also cover policy priorities that we've championed in the past and legislation we hope to promote in the coming year. We'll close out with ways that you can take action as an advocate and provide an opportunity to answer any questions that you might have. Throughout today's presentation, you will hear from several individuals, board members, volunteers, legislators. We're grateful for their time, expertise, and dedication to this very important cause. I would like to now introduce you to Callie Parr, who will share a little bit more about the American Foundation for Suicide Prevention.
Thank you, Katie. Hi, my name is Callie Parr, and I'm an advocate and board member of the American Foundation for Suicide Prevention Montana chapter. AFSP was founded in 1987 and is led by CEO Bob Gebbia. We have a headquarters located in New York City, a public policy office in Washington, D.C., and chapters in all 50 states, D.C., and Puerto Rico. The organization is made up of lost survivors or individuals who have lost a loved one to suicide, as well as individuals who have struggled themselves or support someone who struggles, and individuals professionally and personally interested and invested in this space, such as psychiatrists, psychologists, school counselors, and community leaders. AFSP is a voluntary health organization that gives those affected by suicide a nationwide community empowered by research, education, and advocacy. Our work to save lives and bring hope to those affected by suicide could not be done without the help of you all, our network of volunteers nationwide. What AFSP is not. We are not a crisis center. We do not run our own support groups. Our chapters are not support groups, and AFSP does not give grants to other organizations. Before we get started on the rest of the program, I want to go over terminology that is used when we talk about suicide. It's important to model appropriate language so that we do not perpetuate the stigma of suicide or mental health conditions. We avoid using the phrases committed suicide, as it can have a negative connotation. Instead, we encourage the phrases died by suicide, ended their life, or killed themselves. When talking about suicide and suicide attempts, we avoid referring to suicide attempts as failed or successful. Not only is this unnecessary, these words imply judgment. Instead, we encourage the use or phrases such as suicide attempt, suicide, death by suicide. Educating the public about suicide is critical for encouraging help seeking, raising awareness of risk in vulnerable populations, and advocating for new interventions and prevention strategies for those at risk. When suicide is talked about safely and accurately, we can help reduce the likelihood of its occurrence. We want to change how society understands mental health and suicide, because when we open up and connect, talk saves lives. I would now like to hand it over to Erin Downey, who will now share how you can advocate with AFSP.
Part of our work to achieve AFSP's mission is done through advocacy. Hello, my name is Erin Downey. I am an advocate and co-chair of the Gallatin Valley Out of the Darkness Walk. Our network of volunteer advocates helps us influence policy and legislation at the federal, state, and local levels by participating in multiple avenues. We participate through our advocacy email campaigns, interacting directly with public officials, attending our advocacy events like this one, and advocating over traditional or social media. For those who may be brand new to advocacy, we will share more about the basics later in this presentation. For this event and throughout the year, the AFSP Public Policy Office supports our chapter's work in advocacy and public policy. The office is located in Washington, D.C. The staff work with our chapters and also directly with public officials, federal and state agencies, and other organizations to advance policies and legislation that help to reduce suicide and improve mental health. Part of this work includes identifying and helping to advance legislative and policy priorities for each state, some of which we will learn about today and speak with our legislators about later on. As a volunteer advocate with AFSP, you have the opportunity to stay engaged and take action on suicide prevention and mental health legislation during this event and also throughout the year. You can utilize the AFSP Action Center, which is found at afsp.org/action center, to track legislation and to identify and contact your legislators by email. We will show you how to do this in just a few minutes. You can also continue to interact with your public officials in person and virtually, and share your story with decision makers in the legislature and in your community. You can share with others about your advocacy and encourage others to join us as a volunteer advocate. Finally, if you're looking to get more engaged on the chapter level after today's event, you can talk to us about joining our chapter public policy committee and help to identify the policies that we focus on in our state. AFSP volunteer advocates make an impact in many different policy areas for suicide prevention and mental health. Policy priorities for AFSP overall are determined every 2 years by volunteers on the National AFSP Public Policy Council and by the Public Policy Office staff, and are approved by the AFSP's National Board. You can visit afsp.org/priorities to find more detailed information on our top policy issues, as well as view and download our full list of policy priorities for 2023 and 2024. This is a preview of the AFSP Action Center. The Public Policy Office has set up an action on the AFSP Action Center for today's event that is open for anyone in the state to participate in. Advocates can visit the AFSP Action Center at the link that you see here. There you can email your legislators in as little as 2.5 minutes using pre-programmed emails created by the Public Policy Office that will go to your state legislators. The emails will highlight one of our priorities for today's event, and we will invite you and others participating to customize these emails with your connection to the cause and why suicide prevention legislation is so important. Don't forget, you can also share the general link to the AFSP Action Center that you see here on the screen on your social media accounts and encourage your friends, family, and community to take action today. The action will remain live for 2 weeks after today's event. When you click on today's action in the Action Center, you will be matched to your legislators based on your profile mailing address. You will have the option to select which legislators you want to send a letter to by checking the box to the right of each person's name. Below that, you will see the individual email to each legislator. As a reminder, you may also choose to edit and personalize your letters by adding a couple of sentences explaining why suicide prevention is important to you. We strongly encourage you to do this, as personal emails have a much greater impact than form letters. Now here's a short video that highlights the impact that thousands of AFSP advocates across the country are making by being a part of an AFSP State Capitol Day event.
Each spring, AFSP volunteer field advocates storm state capitol buildings across the country. They raise their voices in support of suicide prevention policies that can save lives. State Capitol Day events allow advocates to meet with legislators, share their stories, provide resources, connect with the community, and save future lives. AFSP advocates are making an impact across the country, sharing one message: suicide is preventable. By creating connections with public officials, AFSP advocates raise the volume of protections for the LGBTQ community. Resources, training, and policies for K-12 schools and higher education. Training and programming for veterans, first responders, and healthcare professionals. Mental health parity, and state suicide prevention plans and initiatives. Join the thousands of AFSP volunteer advocates across the country who are bringing hope and saving lives through advocacy. Together, we are changing the landscape of mental health and suicide prevention. Visit afsp.org/advocacy for more information and to sign up as an AFSP volunteer field advocate today.
While we are virtual every other year when the legislature is not in session, we will be at the Capitol next year in person in early 2025. I would now like to pass it on to Alex Holter, who will share a little more about why we fight for the cause.
Hello, my name is Alex Holter. I am an advocate and board member for the American Foundation for Suicide Prevention, Montana chapter. Now, we are going to go over some national and state level statistics that highlight the need for our advocacy efforts today. You can share these statistics in your meetings with legislators to reinforce the need for change. You can reference these statistics on the state fact sheet included in your participant folder. The Centers for Disease Control and Prevention, CDC, collects and shares data on the number of suicide deaths in the United States each year. It typically takes 2 years for this data to be published, so the most recent data available that you see here is from 2021. In 2021, suicide was the 11th leading cause of death in the United States. That year, we lost 48,183 Americans to suicide, making it the third leading cause of death for ages 15 through 24, the second leading cause of death for ages 25 through 34, and the fifth leading cause of death for ages 35 through 44. Over 35% of those who died by suicide were over the age of 55. According to the CDC in 2021, an estimated 12.3 million American adults seriously thought about suicide, 3.5 million planned a suicide attempt, and 1.7 million attempted suicide. Here is a copy of our national fact sheet. You can view and download the national fact sheet at afsp.org/state facts. Locally in Montana, we lost 350 individuals to suicide in 2021, making suicide the 7th leading cause of death overall. That same year, suicide was the 2nd leading cause of death for our youth and young adults, ages 15 through 24, the 2nd leading cause of death for those ages 25 through 34, and the 6th leading cause of death for those ages 35 through 54. Here is a copy of our state fact sheet that has been shared with all of our legislators, along with the national fact sheet. It is also available at afsp.org/state facts to download and share within your communities as well. I am pleased to now pass the next part of our presentation on to Representative Lori Bishop.
Hi, I'm Representative Lori Bishop, and I want to talk to you a little bit today about why the topic of mental health and suicide prevention is important to me, both personally and in my work as a legislator, and how you can impact that work when you're talking to legislators. I live in Park County, which has one of the highest suicide rates in the state, and I think you probably know that Montana leads in the nation as well. And so doing the work in my district is absolutely critical. I don't think you can be a legislator in my district and not make this really important. I've been lucky. I have been able to also have this be a part of my work life for many years as well. And that included when I was working with youth, and that's how I first got introduced to the topic. I was also sitting as an advisory board member for a local drop-in center. and came to really understand this topic in my community. And so when I went to the legislature, I worked on passing mental health parity in my first session in 2017. And I will tell you, in terms of the importance of you reaching out to legislators, it was someone from Billings that called their legislator on the night before a really important vote on that bill in 2017 that literally got it across the finish line. A legislator who never voted for the bill before, and I don't think ever voted for it again after that, voted on the most critical day to get that bill across the finish line in the House by one vote. So know that legislators want to hear from you on this topic. It's okay to not be an expert. It's okay to not have the perfect words. It's just important that you talk from the heart and that you share the values that are really driving you and that you want to have drive them and their decision making around the topics that you care about. And I hope that you'll use your voice to really improve mental health and suicide prevention in our state. So I'm going to start with you to just help you kind of walk through some of those important ways that you can do that. And first, just understanding the legislative process and where legislation comes from. It starts from legislators, or it can start from constituents like yourself planting the seed for an idea, or sometimes it'll be important groups like AFSP who understand what good policy can look like and work with legislators to really get policies that they've seen work in other places across the line. And then they take it and they're able to get it drafted. And so other places in the country have worked on mental health policy, and they provide really good guides for how we can do some future legislation in Montana. So that's just an idea about where that kind of legislation comes from. And then next we think about, like, how does anything become a law? And it has to go through several steps. I talked a little bit about one important step in the House, but before it ever hits the floor of either the House or the Senate, it's introduced into a committee, either on one side or the other. The committee hears it. They hear from people like yourselves who care about that legislation, who know more about the topic at hand. And then from there, the committee takes action, hopefully to pass it out of the committee if it's policy that we want. And it'll go to either the House or the Senate floor, depending on the chamber. And there again, there will be more discussion and again, more action on the floor. And if it's successful, let's say in the case of mental health parity, passing out of the House, it will go over to the other chamber. It will go to the Senate. The Senate will again hear it in a committee. That committee will take action. If they pass it on, it'll go to the Senate floor. And finally, they'll take action on it. And in general, once it's passed through both of the chambers, it goes to the governor. The governor can either sign the bill and it'll become law, or he can decide, or she can decide that they want to veto it or maybe make adjustments to it. And that finalizes the bill in one fashion or another. And either whether it has an immediate effective date or a later effective date, it eventually becomes law and is embedded in our code. And so, like we've talked about before, if you're wanting to impact that legislation, you want to get to know who your elected officials are. While you can reach out to anyone, it's going to be most impactful when you reach out to those who directly represent you. So that can be at the congressional level, or it can be at the state level. And if you use either of the links that are here, they're going to help you know how to find your representative. And remember, even in Congress now, we're going to have 2 different districts. So you'll want to know that you're contacting the right person in the US House, just the same way you would do that in the state House. So you can use these links to go directly to those sites and find those members, and then you can reach out to them. That can be a conversation that you have with them directly. It can be sending them emails or making phone calls that get shared with them. Whatever way you choose to do it, there are lots of ways that you can engage directly with your legislators to let them know about the things that you care about. So that's it from me. And now I'm going to pass this on to Dory Wilmoth, who can share more with you about how you can get to know your elected officials and become familiar with the AFSP Action Center.
Hello, my name is Dory Wilmoth, and I am past chair of the Montana chapter and an AFSP advocate and ambassador. As a reminder, you can also utilize the AFSP Action Center to identify your personal legislators, under the My Officials tab. There, you will be brought to a block list of all of your representatives at the federal and state level. You can click into each individual to learn more about them. The Action Center is accessible by mobile phone, so you can utilize it in preparing for any legislative meetings. When you click into each legislator's profile on the Action Center, you will find a brief profile, party information, the office phone number, as well as social media handles. You can also let the Public Policy Office know if you meet with one of your elected officials or have an existing relationship with them by utilizing the Report Back tab at the top of the Action Center and clicking on Log Advocacy Actions or Log Relationships with Public Officials, then following the instructions at the top of each page. Finally, AFSP offers several resources all in one place to new and seasoned advocates at afsp.org/advocacy resources. On this page, you'll be able to view training videos, including the sample legislative meeting video, view current laws in your state and legislative priorities at the federal and state level under the Legislative Resources section, read issue briefs on some of our top policy areas, watch previous webinars, and read recent blogs done by the Public Policy Office staff and some of our volunteer advocates. I'd like to now pass the slides to Dr. Jennifer Preble to share with us our policy priorities here in Montana.
For those of you who don't know me, my name is Dr. Jennifer Preble, and I have the pleasure and luxury of sitting on the Montana Board for Suicide Prevention with AFSP, and then also the National Public Policy Council. So I am going to just talk a little bit about our history and where we were when we started advocacy efforts and some of the bills. I'm not going to get into the specifics of each bill number or the process in which they moved through our legislative session, but rather just giving an overall kind of 30,000-foot overview and then moving into the present and where we hope to go in the future and how you each can be involved in those advocacy efforts. So probably most prominent that everybody is aware of is 988, or the National Suicide Prevention Lifeline, that was implemented officially in 2022. And then in Montana, we were able to join those efforts and look at sustainable funding. So some of the nuance is, yes, there's federal funding, but each state also has to have a contribution in order to make 988 a reality and accessible for all. And so in 2023, there were some concerted efforts around a specialized allocation of funding so that we didn't have to go to each legislature and ask for additional funding. That effort will continue as we move into 2025, but I think that it's really important to know that there's always a need for expanding funding. We're continuing funding with the State Suicide Prevention Office, where there's a lot of different grants to contribute to the knowledge base of future research. And then certainly having our State Suicide Prevention Coordinator and some of his staff, who is Carl Roston. Other areas in which advocacy efforts entailed in 2023 included suicide prevention screening in our schools and how we are able to look at screening and referral. One of those was also grant funded that really bolstered school systems to quickly identify individuals, and especially within our youth, that might be at risk of suicide. And these are typically kiddos who don't have access to any other services. And so there's a lot of initiative being done in the school districts to quickly identify through screening tools and then the referral for services, and especially in a rural state as our own with a shortage of healthcare providers. And so there was some legislative action around that, and that was able to go through and is currently implemented in Montana, and we're seeing lots of school districts adopt that. Another area that we were able to successfully advocate is around liability laws for firearm hold agreements. So this was a universally adopted bill. It was 100% passed through both sides of the House and the Senate. And so we're really pleased to see that there was a lot of efforts that recognized that if somebody is in crisis and they want to voluntarily hand over their firearm to someone that they love or know, and so that that individual can temporarily hold on to that other individual's firearm without fear of repercussion or consequence. And again, that bill had passed, and so we're very fortunate to have forward movement within the space of firearms and recognizing that there are people that will voluntarily hand over their firearm in the event of increased suicidality or mental health crisis. As we move into looking toward 2025 and some of the advocacy actions that we can take on a state level, certainly 988 will continue to be on our radar as we look for sustainable funding, as well as continuing to fund our state suicide prevention office and all of the work that is being done to identify best practices and that are based on evidence to make sure that the interventions that are being provided for all ages, including youth and adults, are really being done to what the evidence suggests. We also recognize that there is a need for increased mental health access, and so we're always paying attention to mental health parity and increased access through telehealth and ensuring that people of disproportionate populations are able to seek and receive the care that they need when they want it. And so really focusing on our zero suicide model to decrease the suicides in the state of Montana. So with that, I will turn it over to Angel, who will talk about, now that you have this information, what can you do today and in the days and weeks moving forward as we prepare for our 2025 legislative session. Thank you.
Hello, my name is Angel Schertl, and I'm an advocate and board member for the American Foundation for Suicide Prevention Montana chapter. We'll close today with some next steps you can take as an advocate for AFSP. As we mentioned earlier in the presentation, one easy way to start your advocacy journey is to become an AFSP advocate. If you haven't already signed up as an advocate, you can easily sign up at afsp.org/advocate. We'll also be sending out a notification from the Action Center next week. Be on the lookout for that email, or be sure to visit the Action Center on the website listed above. This will be an easy way to send out an introductory email to your local legislators and let them know that you'd be interested in visiting with them regarding suicide prevention. You can also encourage your family, friends, and those in your community to do the same by sharing a link to the Action Center on your social media channels and tagging AFSP advocacy. One of the first things you can do as an advocate is share your story. In your confirmation email, we have provided you with a template to create your own vignette. I'm sharing mine here as an example. This is a great piece of information to have on hand when you meet with your local legislators. It introduces yourself and shares your connection to the cause. It's also something you can leave behind with them after you visit so they can remember you. We will be sending advocate vignettes to our legislators through the Action Center emails. This email will be available for our advocates and sent out to our legislators next week. If you would like to include yours, please complete and upload your vignette to the share file provided in your confirmation email. We always want to make sure we are telling a story in a safe way, so please be sure to reference the How to Tell Your Story Safely handout as you share your connection to the cause. There are so many ways to use AFSP's advocacy tools to build relationships and stay connected with your lawmakers throughout the year beyond today's event. As a volunteer advocate for AFSP, you receive emails from the AFSP's Public Policy Office that will prompt you to email your members of Congress and state legislators through the AFSP Action Center. You can also meet with legislators in person or virtually. Maybe invite them for a cup of coffee. The AFSP policy is happy to work with any advocate on talking points for meetings. Lastly, the AFSP Montana chapter can always use the help of advocates by sharing suicide prevention resources at your local community events and resource fairs. You can learn more about how to get involved by emailing us at montana@afsp.org or visiting our website at afsp.org/Montana. This concludes our presentation. On behalf of the American Foundation for Suicide Prevention, we thank everyone for joining us today. If you have any questions on today's presentation, please text 406-518-1725 and someone will follow up. Thank you.